Oh, Dr. Mimi, I see you. Welcome on in. You jumped right on in. I see you. Hold on, let me just send it out. Give me one moment. Let me post it to my story. Welcome on in. I see you. Thank you so much for grabbing your daily heart.
I'm so special, I'm so special, so special, so special. That's why I'm strapped with me 45 special. Boy, I bring it together, they want chase like metal. Tanta. I'm so special, I'm so special, so special, so special. Tell them enough fear, two-face expression. Like, you know, dirty mouth can't chase them, they tell me them shot. And I said them on me head from black box. Me burn the fire to it, spread from that better. Help poor people with them bed from that. SSC, dirty heart, you are go dead from that seat. Now them a send me mark to it. And each time I walk them say me walk to it. You see, them like me don't go, me can't forget. God, you over did I got me.
Dr. Lolo, I see you. Welcome on in. Everybody joining on in. We're grabbing our daily. Y'all know the drill. We're grabbing our daily harmony. We're liking the live. Once we hit 5K likes, I'm going to go ahead and get started. And y'all know I always got my tunes going in the background. Dr. J, welcome on in. Welcome to my office hours with Dr. Johnson. Everybody, we're grabbing our daily harmony and we are liking the live. As we know, you know, the algorithm has been kind of weird, so let's make sure we're reposting as well too. Dr. J, welcome on in. Dr. Mimi, welcome on in. Dr. Lolo, welcome on in. I see you guys. Thank y'all for jumping on in early. Blessed Believer, welcome on in. Good evening. We all know the drill. We're grabbing our daily heartbeat and we are liking the live. Once we hit 5K likes, I'm going to go ahead and get started on our trending topic in healthcare. You guys know I run through a trending topic in healthcare. The second part of office hours is my interview. My guest is already in here. And the third segment is Professor Tips. We always end it off with Professor Tips. Housekeeping duties, thumbs up or praying hands is me just acknowledging you guys in the chat. So I appreciate you, Dr. J, for grabbing your daily heart me. Gonna get me there, okay? Did I post it to my story? Did it get posted? Give me 1 second. Let me just... try to... Things get weird.
She make a rebel, says she's stressed. Them a request, them you say yeah, we have the best. That's why y'all speak out my home and I blow up my phone. Cause she want the vitamin S. Y'all want smoke a cigar and I run down a car. Cause she want the vitamin S. Y'all a hot button a skirt and a pop off my shirt. She want the vitamin S.
Okay, I think it posted. Okay, we good. Much for the donut. Dr. Lewis, welcome. Oh, we just got all the doctors that's joining on in early today. I like that. All the doctors line up. I love that. Thank you for joining office hours with Dr. Johnson. I love that. Dr. Lewis, I see you. I got all the doctors in the chat tonight. I love that. I appreciate y'all. Y'all know the drill. For the folks who are not new here, we know the drill. We're getting to 5K likes. Once we hit 5K likes, I'm gonna go ahead and get started on our trending topic in healthcare. As you guys are coming in, we're reposting. You know, we got to work against the algorithm. Right now, TikTok is tripping, but we're going to trip back. Hello. Let me pull up my trending topic. Yes, Dr. Lewis, we always have to make sure we trip back. Exactly. Dr. Lewis, how are you feeling? Are you feeling good now? I'm glad to see you're back. Okay, we good. Okay, you're doing well. Okay, good. I'm glad to hear. You guys, we are halfway there. Once we get to 5K, we're gonna go ahead and get started. And as you guys know, as the office hours continues, people will trickle in. So we're gonna get started because you know we all busy folks. We all got things to do. So once again, 5K likes. We're gonna get into our trending topic. Then we're gonna get into our interview. You guys always know I'm excited for my interviews. My interviews are top tier. Bree, I see you. Welcome on in. Thank you so much for being here. We're grabbing our daily heart me. We're liking the live. We're also reposting. We're gonna work against the algorithm and TikTok's algorithm. We love TikTok. We love the algorithm, and we love what TikTok does for us. Okay. What I tell y'all back, we got a trip back. Yeah. Oh, let me pull up the professor tips. Hold on, let me just get all my stuff ready. Because y'all know I do my homework. I'm prepared. Give me one moment. Okay, we good. Okay, y'all getting me 4.2K likes. We're almost there. Y'all, it happens quick. It happens quick. We get there. Bless Believer. Thank you. I appreciate you liking the live. Dr. Lewis, I see you. Thank you so much for liking the live. Dr. Mimi, I see you. Thank you so much for liking the live. I hope y'all, we just getting started. Hey, we just getting started. Oh, we good. Okay, we got to tighten up. We got to get professional. Everybody, welcome on in. Thank you so much for being here. Welcome to Office Hours with Dr. Johnson. For the new folks, I just want to run through what we do and how we do things over here because Dr. Mima and Dr. J, I know you're new over here. Each of my office hours, I do a trending topic. I briefly go through a trending topic in healthcare, and then I do my interview, and then we wrap it up with some professor tips. Those professor tips can be a variety of topics, either tips on, how to excel or succeed while you're in school, or tips on something relating to your mental health, or tips on something for everyday life that you could apply to your everyday, living habits. So the professor tips are not necessarily always going to be about education. It's a variety of topics. Dr. J, everybody else, Dr. J, because so many people call me Dr. J too on social media and at the schools I teach at. So to be calling somebody else Dr. J, feels so weird. Same thing with me. My first name is Anthony, but my name is very common. And it feels the same way too when I call somebody else Anthony. Is so weird. So Dr. J, welcome on in. Thank you so much for being here. Thank you. My trending topic in healthcare. The trending topics in healthcare, I like to just breeze through them, okay? I bring you guys real news, real information of what we should be talking about. Dr. J, I see you laughing at me. Real information, real facts, real situations, real logical association. New and proposed policies affecting access to mental health care services. I want to repeat that title one more time. And as people are coming in, I'm going to briefly be going through this, okay? And briefly just touching on it because I want people to just get a glimpse of what's going on in communities, okay? In our communities, okay? New and proposed policies affecting access to mental health care services. So, several policies that could substantially reduce access to mental health care and substance use disorder services at a time when health challenges are being implemented or proposed. It's a lot that this administration we don't like to get too political. I like to bring you guys, what's really going on in our communities. That's important. And this administration, they're doing a lot. Once again, this administration, they're doing a lot. Okay. These actions span multiple federal agencies and affect from insurance coverage to agency funding and to specialized services for vulnerable populations. I want to repeat that one more time. These action plans, these actions span multiple federal agencies and are affecting various aspects of mental health care systems, from insurance coverage, agency funding, specialized services, and vulnerable populations. That's us, or that's somebody who we know, right? That's Medicaid program accounts for 1/4 of all U.S. spending on mental health and substance use disorder treatment services. Despite its critical role, the One Big Beautiful Bill Act, which was passed on July 4, 2025, it will cut federal funding for Medicaid by 15% or $1 trillion over the next 10 years. That's what their plan is. That's what they're proposing is. And over those next 10 years, they're going to be cutting the access to mental health care services. That's wild. And Dr. J, the brain psychologist, you chose the right office hours to be in here. I like that. Thank you so much for being here. What does that tell us? That tells me, oh, they don't care about our mental health. They don't care about our health overall, because mental health is a part of your health. Okay, we can't separate it. It's all together. It's part of our health. What do I always say, you guys? Healthcare is collaborative. Us as people. What does that tell us as people who work in the mental health space? Or what does that tell people who are currently seeking mental health services? My government does not care about me and my healthcare needs. The Big Beautiful Bill Act affects the access to mental health care services. And that's wild. Just wanted to briefly share that with you guys. Just wanted to if you share this with your students yet. This article was just published last week. I know we've been hearing about the Big Beautiful Bill, but I guess, it's 2026 and their new fiscal year. Yeah, it's a lot going on. So I guess that's why they released this article. But Dr. J, Dr. Lewis, I don't know if you've shared this with your students yet, but this is definitely a topic that should be shared. Okay. I'll email it to you. It is definitely a topic that should be shared for one of the courses that you're teaching. We'll discuss later on after the live. You guys know I don't like to stay on my trending topics too long. I just jump right into it. Aaron, I just briefly went over the trending topic. I'm summing up that the government does not care about our healthcare overall, or this administration, excuse me, you got to choose our words wisely. This administration specifically is not putting the people first. We don't like to just getting home from class. Thank you so much for taking the time to be here. I appreciate you. We're gonna continue. We're gonna brush through this. I don't like to say my trending topic too long. I just want to share with you guys what I found to be interesting. It is scary. We are definitely living in scary times. Do not be afraid to seek help. Do not be afraid to seek mental health care services, even if your government doesn't have you in mind. Okay, let's pep it up. Let's get positive. Caroline, welcome on in. I was just going over my trending topic in healthcare. You made it right in time. Welcome to Office Hours with Dr. Johnson. I was just about to bring up my guest. Hold on, let me see. Is she still here? Okay, she's still here. Let me invite my guest. Dr. Mimi, can you see me? Can you hear me?
Yes, I can see you and I can hear you.
Okay, we can't see you yet. Or you stay in.
No, I was trying to fix my
Okay.
camera.
Yes, ma'am. Good evening. Welcome. How are
Good evening. Happy Tuesday. I'm doing great. Thanks for the invite.
you? Happy Tuesday. Thank you so much for taking the time to step into Office Hours with Dr. Johnson. Like I was sharing, I just briefly go over a trending topic, wrap it up with some professor tips briefly before we get into your interview, because I do have some questions laid out for you. I do my homework, so they're good questions, okay? But what is your take on the topic I was just sharing? They are cutting the access to mental health, specifically. It's cutting access to a lot of different services, but specifically mental health care services. The Beautiful Bill Act. What is your take on it from your clinical background?
So as far as my clinical background is concerned, I am a family medicine physician, obesity medicine, but a lot of my practice is geared towards mental health services,
Mm-hmm.
from a primary care standpoint. So, I mean, if those are the effects of the bill, that's going to be causing some extreme detriment to our patients. I know
Right.
as far as being the visit, but we also outsource a lot to the psychologists and other behavioralists and psychiatrists on it just to try to educate myself on it because I don't want to speak on something I'm not fully, educated on. And I was
Exactly.
seeing
Hello.
like the changes they were specifying with Medicaid and then with
Right.
co-pays and etc. So definitely it kind of like ignited a
Mm-hmm.
fire under me to like dig deeper and to even like bring this discussion to like my to my peers, my
Right.
physician peers and the faculty where I work because this
Right.
is something that we definitely need to be looking at and preparing for.
Exactly, exactly. Dr. Henry, welcome on in. Like I was saying earlier on today, I got all the doctors today in office hours with Dr. Johnson. I appreciate you guys all for being here. So we just jumped right into it. We have to do, greetings and we have to do introductions. So I'm health, community health, at two different colleges, but I decided to come on here on TikTok and bring my talents to the social media. Continue doing what I'm doing in person because I saw that there was a need. So that's what brought me here on TikTok. So I appreciate the algorithm so much for consistently, continuously bringing me people like you. Can we drop subject matter expert in the chat? Can we drop my sticker subject matter expert in the chat? Oh, the office. I appreciate you, Dr. Henry. So I just want to tell you, thank you so much for all the work that you're doing on social media because the algorithm thought that we should be connected once I saw your content and we instantly connected and we instantly engaged with the content and I had to send you an invite. So once again, thank you so much for taking the time to step into office hours with Dr. Johnson and share drop some gems background. We're going to jump right into it. I'm going to turn it over to you. Can you start off with giving us your professional and educational background? Whatever, this is social media, so whatever names you don't want to drop or you don't want to share, we all know HIPAA. We all know how to use context clues. So whatever names you don't feel like sharing, you could just drop some context clues.
If I really appreciate the invitation. So I'm Dr. Mimi. I am a family medicine, board certified family medicine physician and also board certified in obesity medicine as well. And as I said earlier, I have an area of concentration in primary care psychiatry. So I'm extremely interested in mental health and mental well-being. So I integrate
Mm-hmm.
that within 4 degrees, one of which is a medical degree. And I'm also an associate professor at a medical school in Florida. So I'm in the Department of Family Medicine there. So I teach medical students and train medical students how to be physicians. So I have the background before I was a physician, I was a teacher. I had my own tutoring company. And so once I finished residency, I ended up getting a job. It's just funny how everything worked out at a medical school, and I've been here since. So I've been a physician since 2015, and I've been practicing and a faculty member, a teaching faculty member since 2018. So I'm going on 8 years. So a lot of what I do is I do see patients.
Mm-hmm.
I do research, and my research is actually on ACEs, adverse childhood experiences and trauma in
Right.
adults. And particularly, I'm looking at mood disorders, depression, and anxiety, and how we can use alternative interventions to help with that, such as mindfulness based interventions. So I spend a
Mm-hmm.
lot of my time doing research, a lot of my time teaching, seeing patients, and teaching the medical students and course directing. So I run at least 2 courses for the second year medical students, one of which I did my last lecture for yesterday. So I'm relieved because I was on a bit of a marathon there. And so that's pretty much in a nutshell I think my academic career, just the Cliff Notes version.
I love that. Thank you so much for sharing. I'm in Florida too. I'm in South Florida. I'm in South. That's why the
I'm in North
algorithm.
Florida.
That's why the algorithm put us together. I'm in Miami. Okay, we gonna talk. I see you. We gonna talk after we get off the live. I want to jump right into it. I have a series of
All
questions.
right.
She ready? Welcome on in, Dr. Sabrina. I see you. Welcome on in. Thank you so much for being here. I have a series of questions, different topics, subtopics that I want to touch on. You were asking me about what are the questions? What are we going to ask you? You don't know me. You don't know the office hours. I do my homework. You are in good hands. My questions are cultivated all for you. All I needed to know is what was your niche. You gave me a brief rundown of what you do, and I said, bingo, perfect, that's it. So we're just going to dive right into it. I want to kind of touch on the medical education, the teaching aspect of it, okay? Um, I'm big on going back to school, and I love that you're a first generation graduate, and thank you so much for sharing that. But I'm also big on sharing our experiences. You know, I'm big on representation. I come on here, it's never to boast and brag. It's always in a way of, hey, if I could do it, you could do it too. So, what do you think medical start into the clinical practice?
Do you mean like the medical student or the medical school or actually into the practice?
Medical
Like once they
students,
graduate?
yeah, once they graduate and they that medical school didn't really teach you, but once you got into your niche, you did clinical practice, you learned it.
So I'm gonna be straight 8. So I
Okay.
had like a lot of full-time jobs. I
Okay.
taught high school in an underserved area. I had 3 kids. I was married at the time. And so like I was used to like adulting. So from an emotional and psychological standpoint, I feel like I was at a I was at more mature place than
Okay.
most medical students. So it was
Mm-hmm.
very stressful for them. But when I did graduate, I feel like the type of individual who is successful in matriculating into medical school and making it through is very driven. And so you have
Okay.
like that perfectionistic kind of, way about you that's pretty much like, I want to say kind of like perfectionistic, like that are going to do whatever they got to do to make it. And
Mm-hmm.
so one thing I feel like is lacking in myself and a lot of people is the ability to kind of like set boundaries
Mm.
and put yourself first, like say no and to not like and to like reduce your expectations to more realistic, because I feel like the expectations we set for ourselves or allow others to set for us is really high. And so I myself have like succumbed to like burnout a couple of
Okay.
years ago that was really bad. And I see like a lot of my peers now are like still like in a very bad state of burnout. And it's because like we were taught like work, 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 like excel, like see
Mm-hmm.
patients, do this, don't say no, don't set boundaries. And I feel like that's one of the biggest things that a lot of students aren't prepared for. But it's
Mm-hmm.
also like one of the things I work the hardest with the medical students that I mentor. It's like, what are you doing for self-care? When are you sleeping? Like,
Right.
what do you like to do to relax? Like, let's make a schedule. Like, these are skills that you need to learn how to do now because it's not going to get any better for you. The stress may go from studying so much and learning so much to like
Mm-hmm.
seeing patients and having to deal with things that you are not necessarily psychologically or emotionally prepared for, or deal with death, deal with disappointment, and just like a plethora of things. So those from my
Mm-hmm.
own personal experience.
I love that. Thank you so much for sharing. And in office hours with Dr. Johnson, we are big on being transparent and just keeping it above, keeping it 100. So never feel as though you gotta put on. See, we love representation over here. Okay, I want to continue. I'm big on pivoting, and in my mentorship and within my students who I do internships with, I'm always telling them, hey, don't be afraid to try different things. You know. So, what advice would you give students who are unsure about choosing family medicine or unsure about what niche to go into as it relates to a medical practice?
I say keep your options open and
Mm-hmm.
explore like multiple different specialties.
Okay.
So like if you were to ask me now, like you can ask me now if I could like choose another specialty.
Mm-hmm.
If I had to choose a specialty, would I choose family medicine again? Probably I tell you no.
Okay.
And so like I went to a med school that was big on like primary care and like the mission that was like coming from like being a 19-year-old single mother on Medicaid. I saw like how, and like you were talking about Medicaid earlier and One Beautiful Bill Act and et cetera. It's like I saw care services or not having access to quality care. So
Mm-hmm.
of course that highly intelligent Black woman,
Right.
a lot of times it doesn't matter what specialty you're in. People are gonna feel like you got here because of DEI or some other like boost other than your
Mm-hmm.
intelligence, other than like because of how you look. But I would just say keep your options early open, because the medical school that I teach at, like, go where you're interested in, and I'll explore. I'll help you. Like, I've had students like that went into anesthesiology, and they did research with me, and I pushed them into that. I have some interested in urology, and it's like, whatever you want to do, like, don't let anybody knock you or stop you from that. And I feel like too, you want to maximize and give you joy, because medicine has like a lot of challenges to it. So you really want to enjoy what you're doing, and you don't want to have like second thoughts or wishing you or regrets.
Right. Thank you so much for sharing that. I want to stay on the students. How do you teach empathy and communication within the clinical setting, which is important?
So with me, I just focus on the person. And so, like, even one of the teaching modalities I do, a small group, I just focus on the person. Like, you can learn all this book work, you can memorize all these medicines, you can know exactly what the diagnostic algorithm is, but if you can't relate with your patients, if you can't build rapport with your patients, if your patients don't feel empathy, compassion to be the best doctor you can be, and it's gonna interfere with your inability to provide the best care. So I like focus on that patient-physician relationship. And even today when I was teaching small group, I was like, it's about partnership. We were teaching about using motivational interviewing versus persuasion and telling the patient what to do. And it's like, you guys are partners. Like, it's your job to help empower them, to motivate.
Exactly. And like I always tell my people over here, healthcare is collaborative. So thank you so much for sharing that. And y'all see that the proof is in the pudding. Just joining on in, welcome to Office Hours with Dr. Johnson. Today we are interviewing Dr. Mimi, a subject matter expert. We're gonna continue to get into some things. Thumbs up or praying hands is me just acknowledging you guys in the chat. I don't want to interrupt my guest. Okay, so we're gonna continue. Dr. Mimi, what does comprehensive care really look like within family medicine today, from your perspective? Comprehensive care.
Like looking at the patient holistically. And so one of our models of our medical school is biopsychosocial. So a lot of times, like, doctors focus on the biological, but I like to include that is also assessing for like social determinants of health. Like, do you have transportation? Do you have enough food? Can you pay your bills? Like, Destiny Child, can you pay your telephone bill? Can you pay your automobile? But like, I like to know all of those things, because it's like, I can't get your blood pressure under control if mentally you're having issues or socially there are some disturbances in. How can we help? How can we make smart goals together? Like, do we need a social worker, or do you need a referral? With food and electricity and etc. Because I'm pretty sure people are not too worried about taking blood pressure medicines if they try and figure out how to keep their lights on. Or, if they're dealing with a domestic violence situation or they're stressed out. Things I like to delve into as part of a comprehensive medical visit.
I love that. Thank you for the way you practice medicine. I want to has shaped you on how you continue to practice medicine today. I told you I did my homework.
Got me thinking through.
Yeah, think through and take your time. Yeah, take your time. That's what we're here for. We are dropping gems today.
I mean, I can't give you one patient encounter, things they've never told anyone else, and just hearing them say, "You're the only doctor who's ever sat and listened to me." I feel like hearing that motivates me to continue every single thing. And now I'm like, oh, where are your pictures from your trip to Tampa? Like, that you took a couple of months ago. I didn't forget. But no, just hearing the patients and seeing the patients open up to me and really look at me is like, they'll say, like, that's the best doctor ever, because she actually cares. She actually listens. And they don't look at me as a doctor. They look at me as like part of their family. So like those type of moments like really make my job so much better. Like, even on days I don't want to go to work, just seeing names on the schedule motivates me, because I know, like, I'm going to go see that person and we have our relationship and we have our bond.
Right.
And to me, for that 20 minutes or that 40 minutes, and I'm going to make a difference.
I love that. I love that. Thank you so much for sharing that. Um, Misconceptions in health, family medicine. Would you say if there are any misconceptions? Because I'm sure there are misconceptions that they have about healthcare administration. How we just care about the money, the business, the money side, and we don't care about the patients. Are there any misconceptions as it relates to doctors who are specializing within family?
Misconceptions necessarily with patients, but I
Mm-hmm.
do think, like, a lot of people have the misconception that family medicine, that people that do family medicine did it because they medicine doctors are some of the brightest doctors I know. And to be honest with you, sometimes I feel like in my alter ego, I would have been a psychiatrist, like Dr. Sabrina that's in the chat. But
Okay.
sometimes I feel like as a family medicine doctor, you have to know like way more, because you have to know so much about every single possible issue. And then you treat, and you don't have to, but we get trained to treat newborns, pregnant women, all the way up to
Mm-hmm.
great great grand. So from the cradle to the grave, you got to know about MS, musculoskeletal, and you got to know
Right.
about skin, and you got to know about pregnant people, and you have to know about diabetes and be an expert at that. And then you have to know about psychiatry. Like, we got to know about every single thing. And especially if, like, you're a physician in a rural.
I hope you're doing well. Just want to check in with the information you had shared me not too long ago. Please send me a message once we get up off here, just to check in with you and for us to, reconnect. But I hope you're doing. Add that PSY to the end of your credentials, ma'am, Dr. Mimi. They putting you on the spot in the chat.
No, I think oh, Dr. Sabrina, she's one of my friends I had shared out the live to.
Yeah,
She's a psychiatrist like me. She just went into psychiatry instead of family
I
medicine.
love that.
No, but the way I choose to practice in behavioral health is going to be through my research.
Mm-hmm.
So I'm trying to get a grant right now through the NIH so that I can
Okay.
do a training grant where I can be 75% a researcher, and I
Okay.
want to be an international expert in. I look at using mindfulness-based interventions to improve mental health outcomes for
I
under-resourced
love.
individuals.
Is never to boast and brag. It's always about representation. You see what these
Mhm.
black professionals are up here doing. Y'all can do it too. I'm not the doctors in the chat. I ain't talking to y'all. I'm talking to everybody else who aspiring to get what we're doing right now. And Dr. Lewis, I hope you're in the chat and you just heard what she shared. Dr. Lewis in the chat, she's in public health, but she does a lot of grant work as well too with her organization. So I definitely want her to connect with you. Let's continue, man, because we just halfway there. Um, as it relates to primary care, I want to dive into that a little bit more. What are some of the biggest challenges facing primary care today, or that you feel are faced among primary care?
Um, it's kind of difficult for me because I'm in academics,
Okay.
but I definitely feel like from an academic standpoint, we need more faculty.
Mm-hmm.
Like, we need more reinforcements, right?
Okay.
Insurance is where they're looking at value-based care versus like looking at work RVUs, and it's all about like the Benjamin, or not just make the most money off a visit, but like, what's the impact on the patient? Like, are they getting better?
Right.
And are they getting better at like a quick enough pace? Like, are we investing in their wellness versus are we investing in like how many patients we can see in a short amount of time? Because even like when you go to specialists like ortho and et cetera, like I remember in residency, they would have like 30 plus patients scheduled for a day on one clinician schedule. Like, how can you see 30 plus people and provide them with excellent quality care and then
Right.
don't miss anything? There'll be no malpractice, no negligence. That's not humanly possible. Like, for
Exactly.
you to like care. So I feel like we're fighting against time, and we're
Mm-hmm.
fighting against like unrealistic expectations as far as metrics, and then we're taking away like the time and energy we need to provide the best care for patients.
Right.
And a lot of times when patients wait months and months to see doctors, the doctor's going in and out, in and out, in and out really quick. Like you wait in the waiting room and in the intake longer than you get to spend with the clinician.
Right.
So you better have your list of things, otherwise you're gonna leave saying I didn't even get to talk about these 3 things until like the next episode, whenever you're scheduled. So definitely time limitations, unrealistic expectations from like the insurance companies and like the administrative, because they're looking at the dollar signs too. And I feel like clinician burnout is one of the major issues, because even my peers that aren't in academics like I am, I'm hearing a lot of dissatisfaction, cynicism, and etc.
Mm-hmm. Mm-hmm. I want to kind of piggyback off of this. But how can healthcare systems better support primary the academia route? Then let's take it academia.
Okay. For me, I feel that just making sure that there is, I guess, a balance or protection between the academic part and the clinical part.
Okay.
So, say for instance, like I just directed a course and I had to do a lecture, so I didn't get to do clinic that much. So I still have patients that need to be seen, and I still have messages. They're still asking for refills. They're still sending clinical documents. They're still sending messages. It's like it doesn't go away, but I still have to teach. I still have to run a course. I
Right.
still have to work on the grant. I still have to do all these things. So it's like you wearing so many hats with one head. And it's like, I don't want to be a jack of all trade and a master of none. And so it can be very cognitively overwhelming. So in academia, you may not see patients as much, which I'm glad, because I don't want to see patients. And I feel like if we had more coverage, if you had like people to like pick up the slack or cover, or you didn't have to be concerned about like what's going on clinically with the patients while like you're teaching or you're at the medical school, that will make it a lot easier, having those systems set in place to make sure that those things are covered, so it's less of a cognitive load for you.
Right. Right. Makes sense. I like that. Staying on the topic of burnout, we're gonna take it there. How do you personally manage burnout and maintain work-life balance with you having your hands in so many different pots and doing so many different things? How do you personally manage burnout and maintain work-life balance?
Yeah. So I was extremely gained a lot of weight. I was almost 300 pounds. So I'm down
Okay.
like 100 pounds.
Congrats. Okay.
And I had to take drastic times, had to take drastic measures. But one thing that I started doing, because I used to be, and I'm like, all the things I'm stressing about, and like people are here living on an island. So I got into island hopping, which is like what my name on my TikTok is. Like this is my name, but if you go to my it's the Island Hopping Doctor. And so like for 2 years, I island hop like almost every month.
Nice.
Every month I island hopped, and that brought me out of burnout. The traveling, the getting to see new places, driving around new countries, and most of it I did solo. But it gave me a time to reflect and just like bring myself back to me, and just kind of suck myself out of the black hole of like burnout, despair. And so like me taking intentional time for myself was, I think, instrumental to me getting out of burnout, because I hadn't done that before. I put all my energy into everything, into my job, into my kids, into my relationships, into everybody else. And this gave me an opportunity just to invest in myself. And I would credit that for like the biggest reason for me coming out of burnout. And so I don't take trips as often anymore. My bank account has determined to myself. And even if it's like a day trip to the beach, a 2-hour drive or an hour and a half drive to the beach for a day, I do that, or over the state.
What institutional changes are most needed to support physician well-being or faculty well-being overall? What would you say from your overall experience so far?
Well, the first thing I'm gonna say is just making sure that you have enough of faculty to share the load so that it doesn't get placed on other faculty. If there is clinical duties, making sure that you have a safety net or a safeguard for coverage. Because I think for me, in my experience, like having a shortage of faculty even like when you're on vacation, there have been times where I've been in other countries on vacation and I had to have the VPN to like do my own inbox. And so that doesn't help you like fully disconnect because you still have to cover that. So having that faculty coverage.
Dr. Mimi, subject matter expert, okay, professor at a medical school and subject matter expert as it relates to everything family medicine. And another one of my doctor friends that came in here, the health hub with Dr. T. And after all these years.
So it has changed, but ultimately it's been always the people.
Okay.
Just health and medicine, because I feel like sometimes my best work has been in like being encouragement, being a support system, and just helping them through certain situations more so than prescribing a medicine or coming up with a diagnosis. It's just my presence, I feel like, has provided the ultimate healing for a lot of people. And just to play that role, that means and not just medicinal. I feel like that's an important role. And it's like, if not me, then who? Like, who's going to do what I'm doing?
Right.
Because it's not, there's not that many doctors that actually listen. Like, even as a doctor, for me, I've been to doctors and I'm like, the quality of care I have gotten, and you knew I was a doctor, it makes me so sad because I'm like, well, what y'all doing for everybody else?
Hello.
I'm not a doctor. If this is the way I get treated, how are you treating the other folks?
Right. Right. Thank you for
So
sharing
it's like,
that.
I have to go hard with them because if I don't go hard, who gonna go hard?
Exactly. Exactly. And you know what? That just reminded me of Dr. T. That when I interviewed Dr. T, she said the same thing or along the same lines. She has to continue showing up because who else is going to do it? You know? Um, as it relates to the future and going forward, how do you see the role of family medicine evolving over the next 5, 10, 15, 20 years from now?
So, I know that there's been an influx of we have a PA school at our medical school, but you have physician assistants, and then you have we call them APPs, advanced practice providers, which can be a PA or advanced. And there will be more people in the workforce. So I'm just interested to see how that is going to play out because I think I see like especially when it comes to mental health, a lot of the I think I'm seeing a lot of PMHMPs that are doing like individual practice. So I'm wondering like what that's going to look like for family medicine, especially since we have AI involved and now we have a lot of telehealth. I don't know how it's going to look, but I'm interested to see like what it looks like as far as scope and just like percentages of the different practitioners that are in family medicine. But we definitely need more primary care providers.
Office visit with patients, or do you like telehealth, or do you like a specific visit for a specific type of visit, either a telehealth or in person, depending on what the patient needs are?
So I think it depends on what the patient needs are, but actually I work on obesity and mental health care. That's my area of expertise. That's what I'm doing research on. But that's one thing I had to do this month because I've been teaching and I'm not able to be scheduled in the clinic. So I was scheduling. And I actually think for mental health purposes, I really think telehealth is awesome. And so that's what I've been doing because it gives me more time with the patients and I could just focus on that one area, which I love to see. And then really work on doing like motivational interviewing, brief CBT, and then setting goals and actually accomplishing something versus rushing through an appointment schedule to the next patient.
Right. Right. I love that. I have 3 more questions. A good doctor to you. A good doctor. What does it mean when you hear that phrase? Oh, she's a good doctor. He's a good doctor. What does that mean to you? What comes to mind?
So the first thing that comes to mind is a doctor that is knowledgeable and up to date.
Okay.
That's going to like be able to identify like correct needs as far as like your labs, your diagnoses, and etc. I feel like that has to happen. Like you have to know what you know and what you don't know. You have to know when to refer. You have to know like what not to miss and all of
Mm-hmm.
those things. But I feel like being compassionate, patient centered, and putting the needs of the patient at the forefront,
Mm-hmm.
being a good communicator, a good listener, and just a good support system for that patient makes up what I would consider to be a good doctor.
Right. I love that. Thank you for sharing that. And we doing all this mental health talking and all this as it relates to patients. But what does Dr. Mimi do to stay on top of her mental health? You did tell us you like to island hop, but on the day-to-day basis, what does Dr. Mimi do to stay on top of her mental health overall?
Therapy for 6 years. Um, I've learned since I do mental health, I learned a lot about like cognitive reframing, like reframing your thoughts,
Mm-hmm.
recognizing negative thoughts or thoughts that fit certain maladaptive patterns. I've really gotten into the mindfulness based stress reduction. I took a course at Thomas Jefferson University, which kind of led me to want to trying to steer my research to that
Mm-hmm.
because I feel like doing some mindful, introspective, reflecting, journaling, um, and just letting go. Being grateful, practicing gratitude.
Mm-hmm. I love that. Thank you so much for sharing that. Can I just have two people in the chat write let go? Because it's important for us to let go. Whatever it is we're holding on, whatever grudge we're holding on to, kind of active and we're still collaborating with each other. Perfect. I see you, Dr. Henry. Thank you so much. Aaron, I see you. Thank you so much. Dr. Mimi, Sierra, I see you. Miss L, I see you. Thank you so much. Yeah, Dr. Henry, yeah, we speaking your language, ma'am. Dr. Mimi, your last question. Now, some of my folks who in here who are seasoned here, they know this last question that I'm about to ask you. Dee, I see you. Thank you so much. But Dr. Mimi, as it relates to the work that you do, what is your overall?
So my overall why is the difference that I make, the difference that I make for students, the difference that I make for my mentors, and almost 8 years. And
Mm-hmm.
so, for instance, I spend more time with the first 2 years of medical students than the third or fourth because they're on rotations.
Okay.
So if you think about it, if you got 120 students times, let's just say 6 years, that's a lot of future doctors that I get to play a role in impacting. And I'll play a small role in shaping who they are. And then in my mentees, being that support system that I didn't have as a medical student, teaching them how to do research, how to write papers, and how to like gain new skills, and just to have somebody that looks like them to support them, I think is extremely helpful. Because I didn't have that, and I just had to get it out in the mud.
Right.
And then for my patients, if
Right. Well, once again, thank you so much for being here. I want to tell you thank you so much for taking the time. I know you got a busy schedule. I know you have so much going on. So thank you so much for stepping into office hours with Dr. Johnson and dropping these gems and sharing your overall experience. The work that you do is important, and they are telling you thank you in the chat. I see you.
you're
Dr.
welcome.
Dr. Mimi, I do monthly conferences, so we're definitely going to stay in contact. I would love to invite you for a monthly conference, in contact with you, and we could possibly plan a conference together around a specific topic or specific niche that is important to you. Okay, ma'am?
All right, thank you so much. I really appreciate it.
No problems. All right, now that was Dr. Mimi in the chat, another subject matter expert. You know, over here in Office Hours with Dr. Johnson, we only bring on subject matter experts because what subject matter experts is what we enjoy. I love that you enjoyed that, Dr. Henry. Thank you so much for being here. Sierra, I see you. Thank you so much for being here. Blessed Believer, thank you so much for being here. We're gonna wrap it up with Professor Tips, okay? Briefly gonna wrap it up with Professor Tips. Um, a lot of us have gone back to school. It's a new year. So a lot of Dr. T, I see you. Welcome on in. Thank you so much for being here. Oh, Sierra, that was your auntie. And Sierra, I'm sure you're proud to say that was my auntie. I'm sure you're proud to see your auntie doing great work. Thank you so much for saying that, Sierra. I see you in the chat. Dr. Mimi, I still see you in the chat. So it's the top of the year. Right now, we're going to transition over into the Professor Tips aspect of office hours. We're at the top of the year. So that means that new semesters have started. Some of us have found new jobs. It's the top of the year. We got to reorganize. As it relates to starting your new semesters, all those students out there, um, there are a couple things I wanted just to briefly highlight with you. We're working. See if you could utilize these tips elsewhere, okay? But as it relates to studying, highlighting more. You got to do more, okay? Highlighting is just highlighting is not studying, okay? Also, studying longer does not mean you studied better. I see you, Aaron. Also, if you can explain it out loud, you do not know it. If you cannot explain it out loud, you do not know it. Dr. T, if you can't explain the treatment plan out loud, you do not know it. Aaron, if you cannot explain the new lecture you just learned, you do not know it. Eve, I didn't know you was in the chat. Welcome on in. I see you, Eve. Thank you so much for being here. We just wrapping up with my professor tips. Once again, highlighting is not studying. You can't just read and highlight that thing yellow or pink or green or whatever color you like and say, oh, you highlighting, oh, I'm retaining the information. You got to do more than that, sweetie, son. I don't know what, you know? Studying longer does not mean studying hours. Right, Dr. T saying, right. Okay. Once again, if you can't explain it out loud, you don't know it. Also, struggling means learning, not failing. So I want to go back to Aaron. Aaron said he's struggling. That's all right. You're learning. This is something new. This is how your brain is responding to this information. Go the course. Okay. And don't give up. Go the course. I want to run through these one more time. Highlighting is not studying. Studying longer is not studying better. And struggling means learning, not failing. I want you, if you guys are not, could apply these quick tips elsewhere in your life, in your career, or whatever else you got going on. Okay? Highlighting is not studying. Studying longer does not mean studying better. And if you can't explain it out loud, you don't know that information. Stop lying to them people and stop lying to yourself. If you can't explain it out loud, you don't know it. And lastly, struggling means learning. Use and furthering our education in our profession, we got to. We got to. We have to. Please share with you guys. Today is January 27th. Okay. Today is my 1 year anniversary of me showing up on this app. Once again, before we wrap up, I wanted to share this with you all. Today is the 1 year anniversary of me showing up on this app, of when I came on here and decided I was going to be a part of Hillman Talk University and teach healthcare. I'm gonna pop my shirt. I'm gonna pop myself. I have met hundreds of subject matter experts, and I have a couple of them in the chat. I have Dr. T in the chat. I have Dr. Henry in the chat. I can't even on here to come and collaborate with me. So I just want to tell those folks out there who are wanting to get on social media, who are wanting to, share their subject matter expertise, continue to show up. King Camille, welcome on in. I see you. I was just wrapping up. I was just telling the people them today is my 1 year anniversary. January 27th, 2025 is when I made my first video. People reposted it. People started to follow me. That's has done. Look at what 1 year has come to. So I just want to share with you all, continue to show up. It's important to continue to show up because we do not know who we are impacting. Thank you so much, King Camille. I see you. We do not know who we are influencing. I'm big on representation is important. And you guys know I'm not no who I have trusted to come in here and just, hold the chat down for me. Okay, so shout out to all my moderators who are moderating from, there's a couple of y'all. Thank you so much for you guys. I used to come up on this app and just be talking to 2-3 people at first. Okay, now my room. Now Dr. Johnson is hosting conferences. I am connecting with people. Me coming up on here and sharing my work, sharing what I'm passionate about, and offer my students entry-level roles. That's why I'm on here. So, I always share with you guys, I'm not really on here for all the clicks and views and likes. I appreciate that. You know, that's a part of being up here on a social media platform. But I really came up on here to be a resource. Once again, I want to make sure I'm emphasizing that. And don't be annoyed if you constantly hear Dr. Johnson, oh, he not here for the clicks and views and likes and engagement. Don't be annoyed when you hear me continuously say that. I just want to stress what my purpose is. It's important to continue to show up, and it's important to stress what is your purpose. My purpose on here is to be a resource. There, when I first started showing up, my videos used to get 200, 300, 400 views, likes, etc. When I post a video now, it's in the thousands. And you guys, once again, it's not to boast and brag, it's to show you, look at what I have. Hold on, TikTok asked if I'm still here with the puzzle. I post something, people reach out to me. Didi, I see you in the chat. Didi, you've been with me for a long time too. Shout out to you, Didi. I see you in the chat, Didi Love. You've been here since the beginning too. Shout out to you. Blessed Believer, shout out to you too in the chat. You've been here from the beginning as well too. Continue to show up, you guys. When I post things, you guys, I wish I could just take a screenshot of my inbox. I will never do that, but I wish I could take a screenshot like this. I feel like you are my professional mentor in real life. So you guys, I'm sharing this now, not once again, not to boast, not to brag, not to be like, oh, big me up, big me up. I don't need the big up. It's for transparency. And I'm also talking to somebody out there too. Continue to show up. Lean into what you are doing, because it will always pay off. And even if you're going the course and it's not what you expect, continue to go through it. You could do it, but it won't come easy. You can do it, but it won't come easy. But let me tell you something. Once you start to accomplish it, some days you sit back and you're just like, wow, I did it. And the wow, I did it feeling feels amazing. Okay? I'm not going to take y'all to First Baptist Antioch Church. I just wanted to briefly share with you all today's office hours. I want to share with you all my achievements. Dr. Henry, I appreciate you. Thank you so much for closing out the goal. We good though. Y'all don't say nothing else. I got my 10 donuts. We good. Nothing else. Thank you. I appreciate y'all so much. Today we went over a great trending topic in healthcare. They are affecting and then we also wrapped it up with some study learning tips and tricks. Okay. Today was a great office hours. Today was a monumental office hours. Today was my anniversary office hours for my 1 year of believing in myself, continuing to show up, and to not be afraid to share what I do and share what I'm passionate about. Okay. Y'all, I appreciate y'all. I'm not going to post nothing more as the flyer for my next conference. Dr. Henry, I see you. I appreciate you. The next conference is going to be good. I'm excited. I'm excited. I'm excited. It is needed. All I'm going to say right now, it's the conference for February. And you guys know I like to have my conferences a theme for the month or bring awareness to something. And what is February? Black History Month. You know I'm going to take it there. Let's lean in. You know I'm going to take it there. It's Black History Month. Come on. But you got, the theme is you. I got to wrap it up. We got to wrap it up. Y'all have a blessed night. Continue to be great. Continue to we dropping the deuces. We having a good night. We're going to continue to show up. Dr. Mimi, always. Thank you so much for what you do, Dr. Mimi. In a rush. Pass me the keys to the jump. What? Okay, we're going to wrap it up. Ooh, killing with the now. Take the microphone off.